Good Wednesday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. Our moment of gratitude today is to our hospital partners, specifically Dr. Keith Gray, the Chief Medical Officer at UT Medical Center, who will be joining us in just a few minutes to talk more in depth about hospital capacity. As a reminder, Dr. Gray was asked by the hospitals to be a representative during the pandemic, and has been working with all of the hospitals on their surge capacities. He is also chairing our alternate care site planning group here locally in Knox County. I'll invite Dr. Gray up here in a few minutes, but first I want to move to the local situation. We have 519 confirmed cases of COVID-19 in Knox County. Additionally, there are 10 probable cases. 400 of our cases have recovered. 51 individuals have been hospitalized at some point in their illness. Currently, there are 6 Knox County residents hospitalized. Again, today, we're thankful to be able to report there have been no further deaths from complications of COVID-19. And now I'll turn it over to Dr. Gray.
Good afternoon to everyone, and thanks for allowing me to give a monthly update from the hospital systems. Again, I am, even though I'm the Chief Medical Officer at the University of Tennessee Medical Center, I'm here representing all of the healthcare systems. We continue to collaborate. We were actually on a call this morning, and we continue to meet weekly to plan as a team to meet the healthcare needs of the community. I want to start a little bit broader and talk a little bit about statewide data, which we get updated on in a lag fashion, a one-day lag fashion on a daily basis. But so, as you know, as you read the statistics from the Knox County Health Department side, we've had a slow uptick in the number of cases statewide. Currently, the number of positive tests from the total number of tests performed in Tennessee is 5.6%. The death rate remains stable statewide at 1.6%. We've had a slow uptick in the number of hospitalizations and specifically patients in the ICU statewide, but a stable number of ventilated patients. I think overall, the data shows that we continue to do a good job statewide from a testing standpoint, and we continue to get confirmation that our statewide efforts at social distancing were very impactful. From a Knox County region standpoint, really Knox County and the surrounding 11 counties, we overall have a disproportionate share of the total uptick in the increase statewide. We continue to do, again, a good job with testing here in the Knoxville region. We have a total number of 2.1% positive tests out of the total number of tests that have been done, and our death rate remains stable and reflects statewide data at 1.7%. From a hospitalization standpoint, we remain at a very manageable level. I think we have 6 hospitalizations in the region today. We've peaked at 13 hospitalizations in the region, not in the county, but in the region during the month of May and June, and peaked at 7 ICU patients in the region. From the hospital systems standpoint, we just want to get out the message that it, again, is safe to return to hospitals to seek medical attention. We do not want you to delay your seeking medical attention, especially if you think you need it or have a chronic disease, as that disease may be further exacerbated. We have seen that as we've reopened for business, we've seen that some patients' chronic disease is worse because they were not able to seek in direct medical care. Again, reemphasizing that we do have telehealth offerings at all the healthcare systems. So if you still are either high risk or have some anxiety about returning to the facility, reach out to your provider and see if there is a telehealth option. We continue to put the safety of our patients that we serve and team members as our highest priority. We are screening all visitors on our campus, and we continue to screen all our team members on a daily basis. We continue to wear face coverings on our campus as providers and advocate that our patients that are coming to our campus along with their visitors wear face coverings as well. We continue to restrict visitation to have one person accompanying the patient that is seeking care, and we are allowing one visitor to stay overnight with any patient that requires an inpatient stay. Shifting a little bit to testing in the healthcare systems, our intent is to test. Now, again, we've talked about before that we toggle back and forth between the utilization of PPE and testing as each one is available. But now that our testing pipeline and supply chain is continuing to be liberated and make testing more available, we do have an intent to test people that require inpatient admission or that require a procedure on our campus. And just to give you some epidemiologic background, the overwhelming minority of patients that we're testing for in the pre-procedural area or time frame remain negative. We have a significantly less than 1% positivity rate of all the patients that we've tested pre-procedurally. Some of you may have questions about antibody testing that is still not being widely used as a part of our portfolio of testing. We are participating with the state and just gathering some epidemiologic data from our team members as it relates to antibody testing, but it still remains to be seen how that data will be used going forward. Again, we do not know that exposure in the past portends future immunity. And so we are not using that test for that reason. We continue to cohort COVID positive patients in our systems, either patients that have active disease or patients under investigation. They remain on specified floors and as to protect our patients and also our team members. And just to give you a positive update, our PPE supplies are adequate among all the systems, and those supply chains continue to be opened up. Lastly, our surge capacity continues to be adequate, although we've seen a slight increase in the number of new cases within the state and an increase in the number of hospitalizations. Our baseline and surge and other surge capacity levels remain adequate. As you look at the numbers, our hospitals are filling up because we're returning and approaching pre-COVID levels of operations. And we know as we continue to monitor the trends that we have the opportunity and the ability to pivot very, very quickly to accommodate COVID positive patients should that trend continue to increase. And the last thing I'll say is we expect a continued increase in cases as we continue to open up and especially as we approach phase 3. We hope that we achieve a manageable plateau, and for the foreseeable future, even as we look at our own analytics, we will be able to accommodate the current growth rate of hospitalized patients for COVID. We remain vigilant. As I said, we have our own analytics team, and their data matches what the Knox County Health Department website is publishing, and also what the Tennessee Health Department and the Tennessee Hospital Association is publishing on a daily basis. And lastly, I will say that we again look to the Knox County Health Department for our lead, and we advocate for the 5 core actions that they are advocating, which is social distancing, wearing face coverings when you're out in public, not just in the hospital system, but when you're in public, strict hand washing, frequent disinfection of high touch surfaces, and staying at home when sick. And the last thing I'll add, especially now that we're returning to sports and I'm a softball coach in my other job, avoiding large crowds. That is very important, and especially those folks who are considered high risk. And so that's all I have, and I will open up now for questions for Dr. Buchanan and me.
All right. Thank you, Dr. Gray. If anyone has questions for Dr. Gray, we ask that you go ahead and pose those first, since he has a prior time commitment that he's going to have to head out for. So if you have any of those questions, please ask those first. All right, and go ahead and please submit them into the chat feature, and remember to put your name and the media entity that you're with. First question, and Elise, if you can say what media outlet you're with. Elise from WBIR asks, you're now reporting 6 people in the hospital up from 2 yesterday. Are ICUs being impacted here?
So at this point, the ICU COVID positive patients remains flat. And so again, we definitely have adequate ICU capacity to handle any immediate COVID surge.
Any other questions? Please go ahead and submit them into that chat feature now. From WBLT, David asks, with an increase of 67 active cases in Knox County, is Knox County seeing any hotspots? How many of the new cases have come out of nursing homes or long-term care centers?
Like we've said previously, you need to consider that anywhere you go in Knox County is a place you could potentially get COVID-19. You need to treat each other as though we may have the infection. Social distancing, wearing masks, washing your hands, and all the things we've talked about. We do have some clusters, and we've talked about the fact that we've had clusters, and we expect to have clusters as we start getting back out and people start gathering more. We're going to see more clusters, so that's not unexpected. We at this time don't have any cases in long-term care or assisted livings, and we're very grateful for that. My father's actually in assisted living, and they're doing a fantastic job of protecting those most vulnerable people in our population.
From Brian Hornback, he asks, are the protocols for all patients in the hospitals the same for all facilities?
In general, yes. As we've mentioned before, UT Medical Center is a one hospital system here in Knox County, which in contrast to COVID, which has multiple hospitals throughout the region. But in general, we've tried to keep our policies and protocols the same.
From WATE, Jeff asks, do you have any clarity to offer on what the World Health Organization had to say and then had to walk back when it comes to asymptomatic transmission? I think that's for Dr. Buchanan.
Yeah.
So there is definitely evidence in several different places demonstrating that people without symptoms of COVID can transmit the virus to other people. We don't have a rate of how often that happens because we just too soon to be able to see that. But we do know that if you're asymptomatic, you can transmit the disease to other people, which is why we're encouraging everybody, regardless of your symptoms, to social distance, wear a mask, wash your hands, clean surfaces, and if you're sick, stay home. But, I'm not sure. I've read the walk back. I think she was looking at some very scientific data, but the bottom line is if you're asymptomatic, if you don't have symptoms, you can still make other people sick. So please do the right thing and protect the people around you.
All right, we've got just enough time, about 2 more questions for Dr. Gray before he has to head out. So the next 2 are for Dr. Gray. And Brian, if you can clarify your question there. I'm not sure if that was an addendum to your previous question or not. From WATE, they ask, you mentioned hospitals having their own epidemiology teams. Can that data be shared?
Well, and I think the forward-facing piece of it is the Knox County Health Department data. We collaborate definitely on a weekly, sometimes multiple times per week, to make sure that our data coincides and that we're not publishing disparate data. Point in fact, our data analytics team gave our senior leadership team an update this morning, but they looked at the Tennessee Hospital Association data and the Tennessee Department of Health data, and all of that data was in alignment. And so to answer your question directly, we use it for internal operations and decision-making, but if what you're seeing on the Knox County Health Department site is reflective of what we're finding internally.
From WUOT, also for Dr. Gray, this is probably the last question we have for Dr. Gray before he's got to head out. She asks, you talked about chronic diseases getting worse due to canceled preventative procedures. Can you give more details about the extent you're seeing this?
Well, nationwide, we were seeing a trend, or at least a published, there were editorials about emergency department volumes being down. As we started to ramp back up, we've seen our emergency department volumes amp up pretty quickly, and we're back to near pre-COVID levels. However, what we've seen that is different is the number of patients that are being admitted from the emergency department is higher than it was pre-COVID. And we've seen some diseases come in that were later stage than anticipated based on what the providers assessed prior to the COVID pandemic. Some of that, again, is related to anxiety about returning to the healthcare systems. But again, I want to emphasize to patients that are listening, or potential patients that are listening to this, the healthcare systems are safe to return to, and our top priority is your safety and the safety of our providers. So if you have questions, please reach out to your primary care physician and talk to them about whether telehealth is an option or whether you should be seen in person.
All right, and her last follow-up question to that was, have there been recorded deaths due to the limited access to procedures during closures?
Not that we can directly correlate. Again, the death rate from COVID-related illness remains stable in this region, specifically in Knox County, but I cannot make that leap to say that we've caused more death by delaying care.
Okay, great. And thank you, Dr. Gray. That's all the time we have with Dr. Gray this afternoon. So thank you to him for joining us. The rest of the questions, if you have any questions for Dr. Buchanan, I see a couple in here, but go ahead and submit those now. The first is from WBIR. They ask if any UT students get sick from COVID-19 on campus, will their cases count in Knox County or will they count in their home county?
They will count in Knox County. That was easy.
Because they're living here.
Yeah, they're living here now, so they're part of our case count.
And also from WUOT, they ask, have there been any positive cases within the Knox County jail to date? And has everyone in the jail been tested recently?
There have not been any people in the jail test positive. The jail is following appropriate guidance to decide who gets tested, who doesn't get tested. I don't believe they're testing everyone, but that's a great question for them.
Okay. From WATE, they ask any new guidance on the state provided masks.
No, we're still waiting for that guidance from the state, and we'll let you know as soon as we know. We're anxious to hear too. If they're safe, we do want to resume distributing them.
From WBIR, Elise asks, since you've been following an increase in numbers in places like Hamilton County, how long has the lag been between the jump in cases and jump in hospitalizations?
Yeah, it's just really been a steady growth. And so we've seen that across the state. So it's not been any big jump in hospitalized cases.
Any further questions, please go ahead and submit them into the chat feature now. From Elise with WBIR, she asks 38% of our positive cases are for people ages 21 through 40. That's 202 people. What's your message to those age groups? Are they just not doing enough to be safe and avoid spreading the virus?
So, we haven't done a deep dive into the specifics of those cases in those age groups. So there are a myriad of things that could be contributing to that. Certainly, those are folks who are out in the workforce. Those are folks who are who were going to work. But again, we haven't had the time to dive into that. My message to everybody, including people in that age group, is follow the 5 core principles. Social distance, wear your mask, wash your hands, stay home if you're sick, and clean surfaces frequently. I think what I would remind people, especially about the asymptomatic piece and younger people, you've also seen an increase in our younger cohort, I think the 11 to 20 age group. Some of those 11 to 20 age groups are in the households or friends with the older folks who are becoming ill. So it's important that we protect each other. And that's what this is about. It's about keeping our community open. And, to use a military term, it's our mission, and it's mission critical that you follow the 5 core principles or 5 core actions. That's going to enable us to keep moving forward. So please do those.
Also from WBIR, Elise asks, we've hit another high number of active cases. Does that place additional stress on contact tracers?
Yeah, it sure does. And for that reason, we've been staffing up. We're bringing in some interpreters and other staff to be able to support us doing our contact tracing. We feel confident that we'll be able to continue to staff up for that and have a plan to be able to do so.
From WATE, Jeff asks, any new enforcement actions on the closure/reopening orders? We ask because our viewers have shared a video of a nightclub with apparent violations.
Concerns about compliance should go to 311, and then those are divided out between the city and the county, and followed up on with education. And sometimes you find out that what people think is a violation really isn't a violation. But anyway, it's really an effort for informing and educating people about how to be compliant.
From Brian Hornback, Knox Schools is about to convene a reopen task force. Has KCHD had input, or will KCHD have input into that task force and its 2 days of sessions to determine the fall semester?
So we have frequent conversations with the school systems and work with them regularly. I believe the task force is made up of folks who represent specific parts of the district and were nominated by, I believe, school district or school board members. So we look forward to the work that they do and the plan that they come up with.
From WBIR, from Elise, have you talked at all with Knox County Schools about protocols and procedures if a student contracts COVID? And what would be your recommendation for schools if a child gets sick?
Yeah, so we actually are in the process of talking to the Knox County Schools about a plan for when students come back to school and how we can work together to manage that. And so lots of work to be done on that side as well. So we're working closely with them to develop a protocol and process for that.
From Brian Hornback, have you watched the high school graduations that have occurred? And if so, are you satisfied with how it happened, or do you recommend any changes?
I'll be honest, I haven't watched them. I really trust our families and our schools to make the right choices and to do the right thing. I've been really busy managing things here and really haven't taken the time to watch those.
From WBIR, noticed your new PSAs in Spanish. How concerned are you about the rate of spread in the Hispanic community?
We're very concerned, and that's why we convened a group of people to help us understand how to get the information out in a way that our Latino population will see it and understand it and use it. What we found is that there's a lot of misinformation, and we're trying to bust up the myths and the misinformation so that our Latino population can be safe and we can reduce their risk.
Her follow-up question is, do you have contact tracers who can speak Spanish?
We do. We have several on staff, and we've actually added to are in the process of adding to our translators as well.
Also from WBIR, can you tell us where those new clusters you mentioned earlier are?
I don't know that we have any new clusters. I've just said we talked about clusters, and they're spread across the community. All of our clusters are kind of just spread across the community. Yeah.
Any other questions? Please go ahead and submit them into the chat feature now. All right, I don't see any other questions coming in, so thank you all for joining us, and we will be back with you on Friday at 12:30. Have a good rest of your day.